My name is Kimberly Morris, and I am a registered nurse in the state of Ohio. I have been a nurse in the state of Ohio for over 17 years. I am delightful that you all are giving me the opportunity to present my geriatric teaching plan to all of you wonderful nurses. As we all know, working in the geriatric field as a nurse can be very challenging at times. These challenges generally arise from complex issues. Some of these complex issues could be cognitive impairment of our clientele. It can also be health impairments that our patients or our clientels develop over time. It can be mental and emotional issues. And also, it can be physical and mobility changes within our population. And what I would like to do is, I would like to give you some insight and some resourceful information to help you develop and prepare an effective teaching plan for your clientele, your patient, and also for the staff. Now, let's take some time here to review the geriatric teaching plan. What I have done here is I have prepared a demographic patient profile for a patient. We're going to say that this patient's name is John Doe. He is 70 years old. He's a male. His marital status is that he is widowed. His education level is unknown. And sometimes that can give us a little bit of a dilemma how to prepare a person's cognitive health plan if we don't know their education. So that's something to always keep in mind too. He does have some medical compromising diseases, or I should say one disease. He has a CVA with left-sided paralysis. He has no known drug allergies, but what's most important here is that he is a full code. And when we have clientele or patients that have full code statuses, we are expected to assure that they have the best quality of life that we are able to provide for them. Our client's history. He's alert and oriented. He's also verbal and he's able to make his needs known. He's on a cardiac diet, which he does show some non compliant history with. He's incontinent of bowel and bladder, which means he's going to need our assistance in his pericare. He's a one person assist at all times, meaning this patient should not be transferring or really doing too much of any type of mobility changes that would require him to hit level ground without your assistance. He is a fall risk and he does have some non compliant behaviors. Teaching goals and outcomes for this particular patient. Patient will be compliant with transfers and request assistance. Patient will improve motor skills. Patient will develop a better management of of their personal ADLs. These are all true and effective goals that can be reached for generally most of the patients in the geriatric treatment plan. Okay, now when you're teaching these goals, when you're teaching these to be goals, you want to also be realistic. You want to design your teaching plan to cater to the patient's needs to assure that these goals can be accomplished. So, let me give you a couple examples in teaching. You will encourage the patient to request for assistance when transferring or when incontinence care is needed. So basically, what this is saying is you want to always stimulate and encourage your patient to ask for assistance if they need toileting, if they want to move from a different area in the facility, whatever it may be. You want to encourage them to request assistance. You always want your patients to wear the proper footwear because that is one of the biggest reasons why our patients have falls. They are not wearing the proper footwear, whether that could be diabetic shoes or whether that could be non-skid socks, whatever it may be, they need to have on the proper footwear. You want them to use prescribed assistant devices. Example, a reacher or a cane or a walker, whatever the patient is prescribed to use to manage their safety, you want to make sure the patient is using those objects. And also, common things that the patients may need. Keep that around them, keep that near them. So when they need them, they don't have to reach or they don't have to get out of bed where they may need assistance. But you know what? They need their items. They're going to go and get their items. The strategies: education is a strategy, participation is a strategy, and monitoring is a strategy. Now, when it comes to evaluating the patient, you want to evaluate the ADL participation. You want to evaluate if they're requesting assistance for their transfers. And you also want the goals to be ongoing goals. These goals should be always be trying to be met. Even if they've already met them, keep them as a goal because patients, you don't want them to regress back into old behaviors. So keep this as a current goal that they need to meet. Also, I have provided you with a resource page that you can use that I also use to prepare this teaching plan, but it can give you ongoing information if needed. And here's the resource page for your use if you need it. And I thank you for allowing me again to come out and present my geriatric teaching plan.